This episode of JING TV is about how to deal with inappropriate clients. So we're going to talk about it. You know, that
the
pink...
white elephant in the room.
What pink?
Pink
No,
elephant. Not pink.
Oh.
You see pink elephants when you've been drinking too much.
Okay. So
Anyway,
we're going to talk
on.
about it. We're going to talk about what do we do about inappropriate clients, and that goes for all types of inappropriate clients. So the big one is when people are asking for sexual services from a clinical massage therapist. First of all, I always think, why? You know, why? It's the oldest profession in the world. It's very clear there are people out there doing it. Why are you messing around asking real massage therapists for it?
I think that's a good way to treat it, isn't it, really? That just actually, if people are after sex, they're going to the wrong place.
And redirect.
Yeah. People get very upset about it, understandably. Massage therapists, we don't want our profession mixed up with prostitution. However, I think if you're professional, and I think the biggest thing in terms of this issue is screening clients from the beginning, and I think we've both been very hot on that throughout our careers. So, and I think that if you're not speaking to your client before they arrive, you are potentially opening yourself up to problems of all kinds. You know, it might be that they're disabled and unable to make it up your steps. It might be that they have a problem that you're not actually qualified or able to treat, or it might be that they're looking for sexual services. So I'd say you need to screen that out with a phone call at the beginning.
So how that works is to get yourself a set of questions to ask your clients, any potential client. And usually by question 3, you know if it's going to connect, you're going to connect or not. And I think one of the most important things that we need to say to therapists out there is you're totally in control.
Yes,
and so
it's
for
really important.
any reason that somebody feels like it's not a good match, it's fine to just go, you know what, I don't think that actually what I do is going to work for you, so you might want to try to find somebody else and just leave it at that. So that is okay to say, and maybe you need to practice that.
Yeah, so the questions are basically, what are you why are you seeking massage?
Yeah, what's going on for you?
What's the issue? Is it a pain problem or is it for relaxation? If it's a pain problem, find out what the pain problem is. You know, is it genuine? Are they able to talk about it in a genuine way?
And you can, one of the good questions to ask is, have you seen another professional about it? Have you talked to your GP about it? How does it affect your daily life? And these are real assessment questions. So if they say, well, it's painful in my daily life. Okay, well, is it difficult? You know, for instance, if they say it's a groin problem, so that's something that might feel a bit like murky waters. You'd say, well, it's a groin problem, so do you have a problem going upstairs? Do you have a problem walking? How do you get to work? And people say, and once you start to ask those questions, or you start to use muscle terms, or
people get the idea. And I think also a big question that I always ask is, how did you hear about me? Who referred you? I remember some poor guy on the phone, I was giving him a right old grilling because I think he did actually have a groin problem, so I was immediately suspicious. And then I'd been giving him a grilling for about 5 minutes, and then I said, oh, well, how did you hear about me? And it was some great friend who was the wife of a great friend or colleague. So I think actually that in itself legitimizes people. However, if you're advertising in the Yellow Pages and somebody calls up asking for a groin strain massage or a relaxation massage, and people are often quite clear, there's pretty big clues that they give, like, am I able to leave my underwear off? You know, people give pretty big hints.
And I guess for us too, I don't know, maybe it's because we've been around enough that I'm not insulted.
Yes,
it's
exactly.
like, so, just try to not get too worked up about it. Like, that's part of society, and it's gone on for a long time, and it's just like it's unfortunate that our profession has been mixed up with it, but it's just sort of like, that's a completely different thing. Be really clean and clear about it. I'm sorry, that's this isn't what I do, and you need to find somebody else. And so just feel okay about that. Unfortunately, we see a lot of female therapists say, I'm just not going to massage men because I don't feel comfortable, or men are looking for something often inappropriate. And I just feel like that's a really unfair judgment of men, and actually in my practice I've really enjoyed working with a lot of men, because I think it's difficult for men to get touch in our society safely and feel like it's okay from a medical perspective. And so when you can offer that kind of work, it really changes people's social experiences as well. And so I just want to say, yes, you should feel safe and put in safeguards, if somebody comes in, they're a new client, there's all that stuff like making sure there's somebody in the kitchen, somebody else around in the house, whatever you need to do, but try to really not cut off that kind of, don't make brushstrokes decisions.
Yeah, absolutely.
And I think the other part we want to say about that, because it's not just sexual services, as Rachel said, inappropriate clients, it's also people who you feel like are calling up and they want some kind of therapy, or they're needing something from an emotional standpoint that might feel like people talk about emotional vampires and that kind of thing, and you start to feel like they really want something different than you want to do in your practice. Again, get that sentence out of your mouth. I don't really think what I do is gonna work for you. And if you do know other people you can refer them to, that's great. And if you don't, you can just say, good luck looking for that. And I wish you the best of luck, and feel really happy to hang up. But don't hang up on Jing. So tell us what you think. I know a lot of people have had a lot of experiences out there. And it'd be great to hear, because, massage therapists, we're out there.
Yeah, absolutely. But screening at the telephone stage is definitely what we recommend. And if you're not able to screen at the telephone stage, then certainly make sure that you screen at your assessment stage. Do not let anybody get on the table who you think is looking for something different from you, other than, pain relief or a genuine relaxation massage. Don't do it.